guys, welcome back for another episode of 5 Minute EMS Review, continuing our series on components of an EMS call, looking today at the secondary assessment for critical trauma patients. So let's define our critical trauma patient. A critical trauma patient has a threat to one or more of their ABCs, the airway, breathing, circulation, or they are experiencing altered mental status or are completely unresponsive. In addition, anyone that is exhibiting a life-threatening or limb-threatening injury of some type would qualify as a critical trauma patient. Finally, with your paramedic intuition, if you just are concerned about the mechanism of injury, that it is severe enough that it may be causing one or more of these threats in the near future, you can qualify your patient as a critical trauma patient. Now, obviously, we've done our primary assessment and we're now going to be needing to do any physical exam that is appropriate, vital signs, past medical history, C-spine, stabilization, that sort of thing. So how are we going to go about that in these patients? Well, these patients obviously need C-spine stabilization addressed in the primary assessment and continued throughout the rest of the call. In addition, we're going to kind of bump the physical exam up a little bit in these patients. They need a rapid trauma exam as part of the primary assessment that can then bridge or continue over into the secondary assessment. So basically, after we address those ABCs in these patients, we want to do a quick head-to-toe exam to look for any other life threats. And a key thing for this, we talked about the ABCs and how some people add a D for disability or neuro status. Well, in the critical trauma patient, we want to add an E. And E is for exposure. And basically, that means we're taking the patient's clothes off and we're looking for hidden injuries. I have a teacher that was involved in my education that likes to use the saying, everyone gets naked in trauma. Now, obviously, we're going to use some discretion in that based on the extent of the mechanism of injury and how the patient is presenting. But for our critical trauma patients, we're pretty much going to need to get them just about naked as far as getting their clothes off to see what's going on. Just like in our critical medical patients, we want to attempt to limit on-scene interventions to those needed for managing life threats and initiate a prompt transport. This helps us to save time and get the patient to a higher level of care. More interventions and further assessment can be done en route. If that rapid trauma exam is done on scene, make sure that a more detailed physical exam is performed en route to the hospital if time and resources permit. Just as in the non-critical trauma patient, past medical history may not be our first concern in these patients, but it is still important, something that we should obtain as time permits, keeping in mind that it may only be able to be obtained from family members or bystanders on scene. So try to work together as a crew to make sure that that information is gathered before you leave the scene. These patients should be reassessed every 5 minutes, if not sooner, and any other interventions performed as needed. I hope that was helpful in addressing the secondary assessment of a critical trauma patient. That does it for our secondary assessments. We will tune in on some of our next videos looking into the sample history and the OPQRST for present illness. Thanks for tuning in. We'll see you next time.